Disclaimer: the data given in this article is for your reference only and is not used as a basis for determining whether you are healthy or sick. Whether you are healthy or not is subject to the diagnosis given by your doctor. This is to declare: when reading your physical examination report, the first thing to do is to determine which units your physical examination report uses. Then convert as needed. For example, mg/dl, this unit is commonly used to report blood sugar values in the United States. Mol/L, this unit is the standard in many countries, including Canada, Australia, and the United Kingdom. Divide the mg/dl number by 18 to get the mol/L number. 1. Heart indicators. The most important blood tests for heart health are the lipid profile, which measures cholesterol and triglycerides, and other tests that assess inflammation, such as hsCRP, high-sensitivity C-reactive protein, as well as homocysteine, BNP, and troponin, which can indicate heart damage. In recent years, research reports have repeatedly pointed out that LDL does not seem to be related to heart disease. But more studies consistently show a strong link between low-density lipoprotein cholesterol, LDL, levels and the risk of heart disease, including coronary heart disease, stroke, and other atherosclerotic cardiovascular events. Lowering LDL cholesterol has been shown to reduce the risk of these events, with a 20% reduction in risk for every 39 mg per deciliter drop in LDL. In this regard, Brother Zhang's personal opinion is, LDL levels should be kept within a safe range for the time being, until the field of medical research is defined. The CKMB blood test measures the level of creatine kinase isoenzyme, CKMB, in the blood. This enzyme is mainly found in the heart muscle, and the presence of this enzyme in the blood may indicate damage to the heart, including a heart attack. 2. Liver indicators. Liver function tests, LFTs, are a group of blood tests used to assess the health of the liver. They measure a variety of substances produced by or affected by the liver's function, including enzymes and proteins. These tests help doctors diagnose liver disease, monitor disease progression, and evaluate treatment efforts. 3. Kidney indicators. Chronic kidney disease is tested by CKD blood test. CKD is assessed by two simple tests: a blood test called estimated glomerular filtration rate, EGFR, and a urine test called urine albumin to creatinine ratio, UACR. Both tests are needed to get a clear picture of the health of your kidneys. 4. Pulmonary and upper respiratory tract indicators. The general guideline for testing the lungs is that results above 80% of predicted values are considered to be within the normal range. However, the exact range of normals may vary depending on the individual and the type of test. Factors such as age, height, and gender determine the predicted values. Normal blood oxygen levels are usually 95% or higher. Some people with chronic lung disease or sleep apnea can reach around 90% of their normal levels. The SpO2 reading on the pulse oximeter shows the percentage of oxygen in a person's blood. If your home SpO2 reading is below 95%, call your healthcare provider. 5. Gastrointestinal indicators. Blood tests are helpful in assessing gut health as it can reveal signs of various diseases such as celiac disease, inflammatory bowel diseases, Crohn's disease and ulcerative colitis, stomach ulcers, food allergies, and even some infections. They can also indicate problems such as anemia that may be related to gastrointestinal bleeding, or help assess nutritional deficiencies that are often associated with intestinal problems. 6. Blood glucose index. Diabetes blood tests, especially the A1C test, are essential for diagnosing and controlling diabetes. The A1C test measures the average blood sugar level over a 2 to 3 month period and helps determine if someone has diabetes or prediabetes. Other blood tests, such as fasting blood glucose tests and oral glucose tolerance tests, may also be used for diagnosis. 7. Bone density indicators. A bone densitometry test is usually a DEXA, dual energy X-ray absorptiometry, scan that uses low-dose X-rays to measure bone mineral content and density to indicate bone strength. This test can help diagnose osteopenia and osteoporosis, predict fracture risk, and monitor the effectiveness of osteoporosis treatment. 8. Human Comprehensive Protein Index. Protein electrophoresis is a blood test that separates and measures different types of proteins in the blood based on charge, size, and shape. It helps identify abnormal proteins or changes in protein levels, which can indicate a variety of health conditions. These include multiple myeloma, other cancers, kidney or liver problems, immune system disorders, and nutritional deficiencies. 9. Blood count indicators. A blood count test, also known as a complete blood count (CBC), is a routine medical test that is used to check the number and type of blood cells in a sample. It provides valuable information about a person's overall health and helps detect various diseases, including anemia, infections, and blood cancers. 10. Thyroid markers. A thyroid blood test, also known as a thyroid function test, is used to evaluate the function of the thyroid gland. These tests measure the amount of thyroid hormones, T3, T4, and thyroid-stimulating hormone, TSH, in your blood. They help diagnose and monitor conditions such as hypothyroidism, hypothyroidism, and hyperthyroidism, hyperthyroidism. 11. Immune system indicators. Immune system markers can be assessed through a variety of blood tests, including antibody tests, tests for specific immune system components such as a complete blood count, CBC, and immunoglobulins. These tests help determine the health and function of the immune system, identify potential deficiencies or abnormalities, and diagnose conditions such as autoimmune diseases or infections. 12. Vitamins minerals indicators. Important vitamins commonly found in blood tests include vitamin D, folate, B9, vitamin B12, vitamin C, and vitamin B6. These vitamins play a vital role in a variety of bodily functions, and testing their levels can help uncover underlying deficiencies and their associated health effects. Important minerals detected in blood include calcium, magnesium, potassium, iron, phosphorus, sodium, zinc, selenium, and copper. These minerals are essential for a variety of bodily functions, and their amounts in the blood can provide insights into overall health and potential deficiencies. 13. Other physical examination reports. The CH50 blood test, also known as the total complement test, measures the functional activity of the complement system in the blood, specifically the classical pathway. It helps assess your body's ability to fight infections and other diseases by assessing the overall activity of these proteins. The anion gap in a blood test is a calculation that measures the difference between positively charged and negatively charged electrolytes in the blood. It helps assess your body's acid-base balance and can indicate whether your blood is too acidic or too alkaline, which can be a sign of certain health conditions. In blood tests, ferritin is a protein that stores iron in the body. This test measures the amount of ferritin in the blood, which indirectly shows how much iron is stored in the body. Low ferritin levels indicate low iron stores, which can lead to anemia or other disorders. Lactate dehydrogenase, LDH, a blood test measures the amount of LDH, an enzyme found in most tissues. In the blood. It is used to assess tissue damage, as elevated LDH levels can indicate damage caused by various conditions. Blood tests measure the amount of uric acid in the blood, a waste product formed when the body breaks down purines in food and drink. It is commonly used to help diagnose and monitor gout, and can also be used to monitor uric acid levels in individuals undergoing treatment for certain cancers. Respiratory count is a blood test that measures the number of immature red blood cells, reticular red blood cells, in the blood. It is the percentage of the total number of red blood cells and indicates the rate at which the bone marrow produces and releases new red blood cells. A normal respiratory count in healthy adults is usually between 0.5% and 2.5%. Sedimentation test, also known as erythrocyte sedimentation rate, ESR, or sedimentation rate, it measures how quickly red blood cells settle in a test tube, showing inflammation in the body. This test is a simple and common way to assess inflammation, which can be caused by various conditions such as infection, autoimmune disease, or cancer.
Dear friends, this video has ended. Zhang will play a video with a completely different theme in a few days at 7 p.m. Eastern Standard Time. Don't forget to like and subscribe before leaving. Thank you everyone.